How you doing today, folks? I'm Blake, and we're here with our ring removal specialist at Ring Rescue, Darryl. How you doing today, Darryl?
Great, Blake. Thanks for having me.
Not a problem, anytime. So, we're here to talk about assessing a hand in the case of ring removal. So, Darryl, when someone walks into a jewelry store, so if it's a jewelry professional, somebody walks in the ER, how should a professional really look at the hand and assess it, and what they need to do for ring removal?
Yeah, it's a great question, and it's a common problem we have all the time when people come in. And one of the things that I always like to do is I like to first ask the patient or the customer, when was the last time that you actually tried to take this ring off?
Right.
Because if you actually look at the finger and it's red and it's swollen and it's kind of angry looking, they probably tried multiple attempts before they even came in to see you.
Right.
Their finger's going to be sensitive to touch because of the bruising and the pain. And, even with a successful removal, it's going to be very uncomfortable for them to do that. So,
right.
In those cases, it might be better to wait a couple days or a week or more for things to kind of calm down before they come back and see you to have that attempt made. I also then like to grab the knuckle. So if we actually look at your finger, for example, I like to look at the actual diameter of the ring versus the actual bone. Like we know that our device will actually shrink the finger 100% of the time, but you can't shrink a hard structure like a bone.
Right.
So we want to feel the knuckle. We want to actually see, is that bone bigger than the ring? And in cases like arthritic joints in the elderly, previous trauma where that finger may have been broken in the past, and the way that it heals and it sets is that bone is a bigger size or diameter than the ring, then you can't shrink that. That ring is not going to come off over that larger structure. So if that's the case, then we make that clear to the patient or the customer. Your finger is actually too large. We can shrink it, which is still going to help with the removal. In that case, we're probably going to have to cut.
Yeah.
But we always want to make that good assessment before we actually give it a go, to make that expectation realistic to that customer or the patient before we attempt.
So is a scenario where you look at the patient or customer's hand and the ring and the finger and you say, you know what, we may have to apply the device more than once. So are there different scenarios where you go 1 round versus 2 rounds?
Yeah, absolutely. Another great question. So, this comes into, when did you last have the ring off? Is this an acute injury, which means that it's more of an immediate case? They had a recent injury to their hand, or recent travel where they dropped in sea level, or they've been exposed to the heat and the humidity, or they've had recent fluid retention, like in pregnancy or heart failure patients, where somebody says to you, well, it's just a couple days ago I had my ring off and it came off no problem, but I woke today and my finger's really tight and it's hard. Those are the cases where those are going to be an easy removal, in the sense of that is fluid retention. We're going to be able to put the compression device on. We're going to be able to pump it up. It's going to be able to apply that pressure and reduce the size of that finger, making it easier to remove. If somebody comes in, they've said, I've had multiple pounds in weight gain, I've last had my ring off 10, 15, 20, 25 years ago, then that's more of a chronic or long-term issue. Those are going to be more of a challenge. Those are ones that you're going to want to set yourself up for. Can you get that back? This is going to be a slow and steady process. Let's put the device on. Let's pump it up. Let's elevate the arm. Let's give it a couple minutes, 5 minutes like we recommend. Then take it off and reassess. And in a lot of those cases, it's better off to then reapply the device, try it for another 5 minutes. But when you shrink the device and you take it off, you're going to see the creases from the cuffs on the finger. And it's recommended that we rotate that device just slightly to then apply pressure in those other areas. Reapply the compression device, pump it up, and then set it for another 5 minutes, and then attempt a removal at that time. But if you're assessing that the bone is bigger than the actual ring itself, again, you're not going to be able to shrink the bone, but the compression device will allow you to reduce the size of the finger, which, if you do have to turn to cutting, it's going to make that removal easier for you.
Right, so there you have it, folks. That's the importance of assessing your hand to ensure if you need to go 1 round, 2 rounds, or if the customer or patient may need to come back. Until next time, it's Darryl, it's Blake. See you later.